Now, I dare say that anyone who's been remotely aware of the regional needs of seniors knows the name Dr. Thelma Bland Watson. Dr. Watson is a quiet force for good. She accepts challenges that would daunt most people. Through her leadership, Senior Connections, our capital area agency on aging, accomplishes tremendous good. We are so proud to learn from her today. Please help me welcome Dr. Watson.
Thank you, Gail. Gail, thank you so much. Well, good morning. I am so very happy to join the panel this morning, and I want to begin by thanking Westminster Canterbury for having us all here. We can see that this is a community without walls, and I feel very welcome and very comfortable here. I don't know if you picked up on some of the announcements that Gail so thoughtfully made, but it just made me smile because there will be so many opportunities for our community to work with Westminster Canterbury, and we're so very appreciative. We are looking forward to the opportunity to help implement the needs assessment that we've heard about this morning. It will bring together the nonprofit community and the profit community in a way that has never happened in our region. So this morning, as I begin, we want to again thank Westminster Canterbury, John Burns, and Gail, and would you all help me do that as we get started with a brief explanation? Of Senior Connections. We'll have some slides here, and I'll just do a few highlights. We really do look forward to working with Westminster Canterbury and other community partners to continue to have healthy aging. Serving 3,600 people with direct services, touching the lives of 22,000 people every year is how we fulfill our mission, which is empowering seniors to live with dignity and choice. And that also includes supporting caregivers. And our vision closely aligns with the vision that we all have in this room, to have seniors with improved quality of life, being able to live life well. So this morning, as we talk about strength and community, to me that means healthy aging. And it is my pleasure to spend a few minutes telling you about Senior Connections and other area agencies on aging. We often hear that people need to know more about what we do. So in a few minutes this morning, I am so happy to be able to give you a quick overview. Area agencies on aging appropriately serve communities. We may be in the form of a government organization. For example, in Virginia, there are 25 area agencies on aging, including Senior Connections. We're mostly regional organizations, although we have 5 area agencies that are part of local governments in Northern Virginia. 14 of the area agencies are nonprofits like Senior Connections, and then we have 6 others who are considered quasi-government, or they may be a part of a community services board, or they may be a community action organization. As I mentioned, we are a 501c3 nonprofit organization here. We are governed by a board of directors, and we get guidance from a diverse advisory council, and we do have the support of all of our local governments. If we take a look at the next slide, I wanted to give you a quick overview of the Aging Network. At the national level, we have the U.S. Administration on Community Living. The trend has gone towards referring to it as community living because there is strength in community. Previously, this was the U.S. Commission on Aging, which is now part of a larger organization. And at the state level here in Virginia, we're so very proud to have the leadership of the Virginia Department for Aging and Rehabilitative Services, DARS. We have some DARS leaders here today, including Amy Marsheen and Devin Bowles, who are in the audience. Thank you all for being here. And then we have throughout the country almost 620 local area agencies on aging. So almost any community that you visit, you'll be able to find an area agency on aging, or a AAA, as we call ourselves. We here in Richmond have many community partners. I particularly want to point out the 3 senior advocate offices that we have, including Henrico in Richmond. Jaleesa Turner was introduced earlier. And then we also have many other point people in all of our local governments who help us to promote and support services and supports for older adults. And then we have a strong network that make our community very strong in terms of people working together. We have a very good local presence in terms of being a part of the community. The role of the 25 area agencies on aging in Virginia is to provide home and community-based services, but also to provide opportunities for support and training for caregivers, and to provide for anyone of any age, because as we heard earlier, we're all aging all the time, and we all need education, information, and opportunities to be advocates. Again, I want to just mention our Virginia Department for Aging and Rehabilitative Services, DARS. We're so proud of our longtime commissioner, Rothrock. And we do have our division for community living, again, following the national trend to include disabilities and aging and people of all ages together, because we can serve people better when we maximize our resources. We'll talk a little bit more later about no wrong door, and of course that means we want all of our community partners working together, so no matter where people go to ask for a service or for information, they can find that. And we've been very fortunate in Virginia to have a blueprint for aging, including age-way planning and opportunities for collaboration. So in addition to Senior Connections, you can see on the slide, we have neighboring AAAs, area agencies on aging, Bay Aging, JABA in Charlottesville, and so forth, and then the Crater District Area Agency on Aging in Petersburg. In terms of building a strong community, the area agencies depend on several funding sources, which you can see here. The largest part of this funding comes from the federal government through the Older Americans Act, which was started back in 1965. So there have been changes through the years, and we hope to see more funding to allow us to continue to expand to serve more people in our communities and to be able to collaborate with more partners. In Virginia, our funds are administered by the Virginia Department for Aging and Rehabilitative Services. We also are very fortunate to have funding from our city and local governments, as well as strong corporate, and there's some business opportunities for us in terms of getting support from the business community and from the foundations, as well as the United Way and others. We have strong participation from our seniors and the individuals that we serve, from the fees and contributions that they provide. And then moving on, I'd like to just give a quick overview of the way that we build community strength in our area agency network. In our case, we have a strong board of directors, representatives from local governments, businesses, and advocates. They set our policies and direct our funding. We also have a dynamic and very involved advisory council. We happen to have participation here from residents at Westminster, Canterbury, including Dr. John Wood. And there are many programs that we are now continuing in the memory of Bob Miller, who was a resident here at Westminster, Canterbury, and we have with us today Jackie Stewart. Jackie is with the Richmond Regional Planning District Commission. The Planning District Commission has been a strong supporter of Senior Connections and many other organizations. We have a very dedicated staff, and then the volunteer network is very, very valuable to supporting the work that we do, including some of the programs we have mentioned here. We have 20 friendship cafes where our participants are able to enjoy healthy meals and very involved activities that help them maintain their health. And then we have volunteer programs such as the volunteer program that provides counseling for Medicare, helping people understand how to sign up for Medicare Part D prescription drug benefits, for example. We have a growing retired senior volunteer program where we can match individuals who want to volunteer with other groups in the community, and many other opportunities for people to get involved with us in the community. Community partners, we couldn't do our work without them. We have counted 150, and we know that this number continues to grow. They include organizations like Feed More, the Community Kitchen and Meals on Wheels, adult daycare centers, community service boards, and about 20 No Wrongdoer partners. Strengthening communities in terms of our staff and volunteers means that we're able to work with individuals and find solutions based on their individual needs and preferences, but also collectively working with organizations like Westminster, Canterbury to address the issues that were findings in their needs assessment. And so these are just some of the ways that we're able to work with our community partners. I'd like to share with you information about our long list of services. These services all work together and support one another. In many cases, services such as adult daycare are provided through community partners, so we're able to leverage federal funding, for example, and to provide those funds to our established daycare centers to provide additional services to families who may not be able to afford the adult daycare support, or they may not be familiar with it and need to be exposed to that service. So that's a way for us to share resources. I'd also like to mention chronic disease management is a program that is funded through our State Department for Aging and Rehab Services, and it is an opportunity for us to serve anyone in the community that would like to learn how to better manage their chronic conditions. We're able to do classes in any setting. A program that we are very pleased to provide in the community is one that's funded through the state of Virginia, and it is our Public Guardian program, where we're able to serve, in the case of Senior Connections, as guardian appointed by the court to about 40 individuals. These individuals live in our community, but they don't have relatives or friends who are able to provide the guardian service for them, so we're able to do that. I mentioned our friendship cafes. We have 20 scattered throughout the Richmond metropolitan area, and then home delivered meals are provided to about 800 individuals each day through our agreement with Feed More, which means we're not reinventing the infrastructure they have. They have thousands of volunteers who serve as not only people who deliver the meals, but they provide a check on the well-being of the individuals who receive the meals. And then I'd like to also highlight, because we heard about some success in terms of providing transportation services for grocery shopping, Senior Connections has been very successful in working with some private and public transportation providers to get people, most especially seniors and some people who are younger with disabilities, to and from medical appointments for dialysis treatments and for other appointments that they need to help maintain and improve their health. And that's an area that I think we could be able to expand on and share with others. I do want to give special thanks to the Richmond Regional Planning District Commission for helping us to continue to expand that effort, and for recently naming Senior Connections as the regional coordinating entity. And then finally, I want to mention Senior Law Day, because it's so much more than just a Senior Law Day. It is actually an opportunity for people to engage in advanced care planning. They're able to, through pro bono assistance, get wills, powers of attorney, and advanced health care directives done. And it's a way for them to jumpstart their conversations with their families so that they can make their wishes known and be able to discuss what their desires are in terms of medical treatment in case they're not able to make those decisions themselves. Moving to our next slide, just a few comments on some of the demographics, which you will be able to find in that great assessment report. And we all know these instinctively, but they really give value to the fact that we need to have services and supports. But we also need to recognize that, for example, we do have a growing population. In Virginia, for example, we have about 1 million people who are age 60 and over today. And by the year 2030, that number will almost double to 2 million. And then one that I really like to talk about is the fact that throughout the United States, we have almost 90,000 people who help us deliver services every day. The Age Wave Coalition was recognized earlier. It is an initiative that started in 2009. In Richmond, we're trying to work together as partners to make communities livable for all ages. And a lot of this work has involved research headed by Dr. Ann Walliford and the Gerontology Department at VCU. And we're continuing to implement. In 2015, we were recognized by Richmond history makers for encouraging regional collaboration. And then we've been able to have some deliverables. We now have the Aging for Life curriculum that's being implemented. We also have started what we're referring to as Phase 5 implementation. And we heard this morning that Westminster Canterbury will be one of our first members as a part of the Richmond Age Wave Initiative, and we want to invite others in the room to join us as well. Now, Phase 6 will be a surprise to Dr. Walliford because this is my sort of vision for the future, that we will have a community institute led by Virginia Commonwealth University as a way to continue the Age Wave work. Moving on to our next slide, I just want to take a few minutes to make a few points to you about the No Wrong Door Service Coordination System headed by the Department for Aging and Rehab Services. The concept of no wrong door has been adopted in large part by the federal government because of the success of the work that we've been doing here in the Commonwealth. All 25 area agencies on aging do use the no wrong door technology to make electronic referrals to other community partners and between ourselves and with the state. And it's a way for us to really build on our strengths as we work to make sure that the preferences, needs, and outcomes of the individuals that we serve are identified. And so this last summer, we celebrated with Bon Secours Health System as they became the 100th partner to join the No Wrong Door system in Virginia. We're really happy to have our hospital system using this. They will be able to take the concept of care transitions, where we're working with individuals as they leave the hospital and go back to the community, a step further by having the hospitals make referrals out to us, and we'll be able to work closer with them in the community. And as I mentioned that we have 100 partners, I wanted to tell you that we have some statewide partners that we all benefit from, and they include the Alzheimer's Association, and then organizations locally here in Richmond. You've heard the comment this morning about Westminster Canterbury working with Project Homes. We also have Rebuilding Together Richmond as one of our partners, and Family Lifeline, represented by Colleen Wilhelm, who's done so much to help us with expanding No Wrong Door. And then, just for a minute, I think we've heard about some of the opportunities and challenges that we have as we work together to make Richmond a community in which we have healthy aging. And that really starts with creating livable communities. And both of our local government speakers this morning talked about the work that's being done in Henrico and Richmond, and we're so proud to be a part of that. But it does include us all working together to make sure we have you, who are the grassroots, working with us to advocate on what the needs are. Policymakers really want to hear from the grassroots about what the needs are. And so the assessment that Westminster Canterbury has conducted will be so valuable to us because it includes information from the grassroots. We do want to always emphasize programs that support healthy aging, and one that I want to mention as we conclude this morning is support for drivers, especially our aging drivers. And through the Department for Aging and Rehabilitative Services, we do have the Grand Driver Program, and there are several retrofit programs. Now, as I conclude this morning, I would like to just suggest that strengthening the community really means that we're combining resources from the federal or national level. We have a national elder care locator where we can work with caregivers and older adults all over the country and put them in touch with resources very easily and very quickly. We have the Department for Aging and Rehabilitative Services with some very important programs, the Grand Drivers Program, the No Wrong Door Service Coordination Initiative, the Blueprint for Aging, the Alzheimer's Commission, and the Commonwealth Council on Aging, for example. And then, actually, to conclude this morning, we are very proud that as we address the positive aspects of aging, that Senior Connections has had put on our building at 24 East Carey Street a mural titled Transforming Perspectives, really intended to show the positive aspects of aging. And I'd like to extend the invitation for you to join us as we unveil the mural on Friday, November 3rd at 3 p.m., 24 East Carey Street. And I don't know if Angie Thalen is in the audience, but I want to recognize Angie. Just stand up for a quick second. This is an initiative that Angie has carried out, and we thank you. And also, Angie has been elected to the Board of Directors for Westminster Canterbury, and we're so proud of that. So in closing, I want to thank you all so much for your support and your participation. We will look forward to many opportunities to work with all of you and with Westminster Canterbury. Thank you.